So yeah, we wanted to get together, and we kind of found that we both had similar interests as far as helping people learn more about nutrition, lifestyle, and just getting back to the root of good preventative health, which I know, with what I do every day, I see there's a lot of information lacking, especially kind of in that mainstream healthcare industry. So yeah, Zeke, why don't you start off telling about kind of how you got started? I know your story kind of starts out when you were a bit younger, as far as taking control of your own health and your trajectory in this space. Yeah, tell us a little bit about kind of what got you into your motivation and really taking control and managing your own health.
Yeah, so I got started at a young age. As a teenager, I had scoliosis and kyphosis in my spine. So I wore a back brace for 2 years. I was diagnosed with that at 14 years old. Prior to that, my family came from an athletic background, but they didn't really know much about nutrition or exercise. Our generations before us kind of had different views on things when it comes to those arenas and fields. And what we're in now, I feel like it's very interesting because even now, what we learn and what we believe in, it all evolves, right? There's certain findings for certain medications that are one way, and then a few months later or a few years later, they're viewed in a different way, or a certain diet profile is viewed in one way, and then now there's other findings that suggest that's not really the healthiest route to go. So
Well,
that
I think a good example of that is your classic eggs are good for you, eggs are bad for
yeah.
you, fats are good for you, fats are bad for you. So yeah, I mean, we even in this day and age, we still see a lot of back and forth even on basic nutrition things, which gets very confusing for people.